We welcome you all to the Harsh Gurpal show of Dr. Harshinder Kaur PATIALA YouTube channel. We both are professors with 36 years of experience. I am a pediatrician and my husband is a physician. My name is Dr. Harshinder Kaur.
And I am Dr. Gurpal Singh.
So, Dr. Gurpal, today I want to discuss about a topic which is considered as the most serious headache, even explosive headache, rather we can say a thunderclap headache. But interesting thing is that actual incidence is 5 to 6 times higher, but because of guilt or shame, majority do not report.
Absolutely. So we are talking about headache, a serious form that is associated with sexual activity.
Of course, and only 1.3% of all cases report in headache clinics, even in the developed countries. What to talk of developing countries, and in developing countries we don't have even that number, because majority say ऐਵੇਂ ही कर दी है.
Right. So because the headache, it is often taken as a joke. You will often find stand-up comedians making stories about that when a wife is not willing or the female partner is not willing, she takes makes headache as a excuse and says, today I am not feeling well, so I will not be indulging with you.
But see, it can be extremely painful and very scary sometimes.
Yes, and it can be frustrating for both the partners also. So as you very well said, it is only 1% people who come with headache associated with sexual activity, but the actual number may be quite high.
It is 5 to 6 times higher, yes, what they have said, because when you ask about this question in the history, majority say yes, less or more, it is there. So yes, it is of course there, but we don't consider it as a disease. So I just want to add on something that in 2004, so mainly it was discussed with the International Headache Society that this must be discussed at all levels. And of course, what happened in 2018?
Actually, in 2004, see, headache is such a common thing that lots of people will have headache at one time of the day or one time in life. They often have it, and sometimes it is so severe and there are multiple causes, and there are very funny names given. Somebody calls the ice cream headache and ice pick headache, and tension headache, migraine, vascular, cluster headaches. Lots of headache things are there, and headache is mostly, when we see in our headache clinics, what we find is most of the cases are referred headaches. They're from the temporomandibular joint, from the teeth, from the sinuses, from the eye problem. So they all get, and even from the neck.
And sinusitis, which is something even seen in children also. So they report severe headache, and mostly we say, get your eyes checked. It is you are just faking.
Yes, and in 2018, the International Classification of Headache Disorders, they tabulated this headache associated with sexual activity as a very separate entity. And how did they define it? Was that headache that is brought on by only during sexual activity, or it can increase in sexual activity, and with increasing levels of excitement and arousal, it goes on increasing till it reaches an explosive amount of headache at the time of orgasm.
Of course, which is known as thunderclap. So it is so painful, unbearable, and sometimes you can have severest form of vomiting also. So that severest headache, which is intolerable, and you feel something is almost about to burst in the head. So that severe headache, still I'm saying majority, even in the developed countries, they don't report till something more serious happens. So I think this lasts from 1 minute up to even, I think, 24 hours or sometimes even 72 hours.
Yes, it can last in the severe forms. It can last up to a day, that is 24 hours. But in the milder form can extend even up to the 3 days times. So the international classification.
So I just want you to tell the various types, so that at least the listeners who are with our channel, at least they should know what is milder variety, what is severe variety. So they have discussed about different types.
Yes. So there are 3 types have been described as headache with sexual activity, this separate entity. So one is that a dull type of headache that starts in the head and the neck region and begins before orgasm. And as the arousal level increases with intense sexual activity, this goes on increasing and then it subsides. So subsidence may take up to 24 hours, as we have
So
previously
gradually
said.
it is decreasing.
There is another type of headache that is intense, painful headache. This happens during orgasm, so starts at the time of orgasm, and again this can last for hours. This is often described as you said, a thunderclap headache. So one of the very severe forms, as if somebody has struck a hammer at the back of the neck. So this happens at the time of orgasm.
So let me clarify, it can happen in both male or female partners, of course seen more in males.
Yes.
But the reason is maybe somebody feels a pinch, but actually when we see the see credentials in Indian society, majority of the females, when we ask them in the history, they say they have never ever achieved orgasm. So this is one of the reasons that females are having lesser of headache. But still, those who have experienced, definitely sometimes, of course the figures I'm telling you again and again, it is 5 to 6 times higher, but because sometimes it is not that severe that it has to be reported, especially due to guilt or shame which is associated, so the female partner doesn't share this complaint with his husband.
Definitely, it needs a separate talk that why women do not achieve orgasm. So definitely both the partners need to understand the orgasm part. Also, we will definitely take it up in another talk. And Harshinder,
But what is the third type?
there is another type. It occurs after the sex. So after the sex has completed, the activity has completed, the orgasm may be there or may not have been there, particularly the female orgasm. The males usually have the orgasm. So there is a mild to extremely painful, and this is one type of headache which is very well defined because it increases with standing, and when the person lies down on the bed, it subsides. So the cause has been found that it is because of the fluid in the brain, the cerebrospinal fluid, which encompasses the brain and the spinal cord. There is a slight leak of that. So that slight leak of the CSF from the brain into the spinal cord produces a very dull aching type of headache, lasts for a long time. It happens after the sexual activity.
I think this is seen more in females.
Yes, but otherwise all these type of activities are more seen in males. 3 to 4 times more commonly in males is there.
So that means once we have described all the details about the headache which is associated with sexual activity, including arousal to orgasm, the advice that usually in the headache clinics that we give to the patients, I think we must share it, because one important thing definitely is it is seen more in those who are not exercising regularly. So
Yes.
exercise means physical exercise, which has to be at least 150 minutes per week, and that has to be strenuous, of course. So that may include running or skipping or swimming or any game you can, whichever you enjoy, you can do it. So one thing is definite: regular exercise is really comforting. And what are the other advices?
Another important thing is to maintain a healthy weight. And third, which is one of the, I think the very important thing, is to avoid usage of excessive alcohol. So this we find
Usually we combine it.
Yes. So in the social media, in the films, in everywhere, it is often portrayed that sex is follows alcohol. But it is very clear that medically we can say that alcohol is inhibits sex. It has a very dangerous implications for particularly people who then indulge in unsafe sex, unprotected sex, leading to many diseases also. And
And of course, I think no level is safe even for the stomach, because we are seeing increases number of cancers, liver failures, liver cancer. Everything is related to alcohol, even if taken in mild amount.
Absolutely. So there is no safe limit of alcohol also, and over a long period of time, it has a very deleterious effects on the hormones, particularly the testosterone.
So you can see, I think, breast engorgement even in males, so that clearly shows, and also some swelling can be seen here in all the males who are taking excessive alcohol.
Absolutely. So the parotid gland gets enlarged, so you can see from a very far off that that person is abusing alcohol.
Yeah,
so
and we ask, even we ask our students to diagnose it from a distance, what this man shows. Yes.
Another important thing is that migraine or vascular headaches are so common, and they can have an overlap with the headaches that are particularly associated with the sexual activity. And migraine has multiple connotations. More very commonly said that this I have migraine, but when you take the history, you find that the headache is not hemicranial. It is not localized to one half of the head. It is not having that pulsatile nature. It is not accompanied by nausea, vomiting. And so sometimes tension headache, many a times, tension headache is wrongly portrayed as migraine headache. But anyway, migraine is very common, and with sexual activity, migraine can definitely increase. So seeing the...
So I think now people can understand, at least they can differentiate whether this is migraine or this is something related only to this sex.
Usually, as we have very well described, I think our audience must be very clear now that it is because of the dilatation of the arteries with increased arousal, with increasing sexual activities. The arteries, they get dilated and you have headache, such severe types. But sometimes there are very dangerous causes, like you could be having a arteriovenous malformation, which is called an AVM, or there could be an aneurysm or a weak artery in the brain that can rupture with the sexual activity. And sometimes uncontrolled hypertension can also lead to bleed in the brain, which can be serious. So the serious causes are definitely there, and if you have very frequent, if it is multiple, if it is followed by some deficit, like difficulty in moving an arm or a leg, or there is projectile vomiting, or there is a speech difficulty, or there is an eye deviation or something of that sort,
or you are seeing double vision or diplopia or any other associated thing which is there, definitely visit the doctor immediately.
Yes, and then you may need investigations like CT, MRI, or an angiogram. But usually, reassurance is all that is required, plus the maneuvers which we have told, that avoid excessive stimulants, that includes alcohol and other illicit substances also, which are very widely used by the younger generation now. And I have seen so many cases where drugs like Viagra have been used in more dosage, even up to 2 to 3 tablets have been taken by young who do not have any rectal dysfunction, just to increase their sexual performance.
But we have seen they have lost vision also.
Yes.
So that is
very serious
really
side effect can be there, and headache is one of the known complications or known side effects of taking Viagra. So we should be very careful when to take it, who to take it. So do not take Viagra as an OTC prescription. Do not go to the chemist, just buy it and take it. It is indicated for persons who do need it, like they may be diabetic or who have organic causes of erectile dysfunction.
So to sum up, I think we have already clearly told you this headache must be taken carefully. Of course, don't be afraid. If it is going within 24 hours, hardly matters, and it is mild, you know it. But once it is thunderclap headache, or you already have taken Viagra, or you are having some associated disease prior to it, do definitely visit the doctor or any headache clinic if it is nearby. But otherwise, stay healthy, and exercise is actually helping you. So I think diet care must be taken because you have to maintain a healthy weight. So check your BMI occasionally, at least twice a year it is must. So I think we should take a leave, and we'll come back again with some another topic.
Thank you so much, and keep listening, keep watching.
Thank you.